Assalamualaikum and hello to the evaluator, Dr. Mara Justin and all my fellow friends. My name is Muhammad Aiman bin Manaim. So today I will be presenting about my defense of research proposal, which is DRP for my final year project for code HPY 590. So the title is The Impact of Post-COVID-19 Pandemic on Quality of Life Among University Students with Low Back Pain in UiTM Campus Puncak Alam Selangor. Okay. The background of the study. WHO announced COVID-19 as a global pandemic on 11 March 2020. The impact of COVID-19 to the global is first, reduce in physical activities, increase in sitting time, exacerbated psychological distress, and people have to stay at home. This is according to the Papalia et al. In 2022. According to Ngotti et al. In 2021, low back pain is a common musculoskeletal problem that has significant physical, psychological, and economic consequences. Research by Mossen et al. In 2022, quality of life is the individual's perception of his or her position in life within the cultural context and value system he or she lives in, and in relation to his or her goals, expectations, parameters, and social relations. And study by Engia et al. In 2018, students typically require prolonged sitting in most of their daily activities, which is to collect resource or to have online classes. Next, for my literature review. Study by Papalia et al. In 2022. For the significant outcome, these studies showed an increase in both the prevalence and intensity of low back pain during the COVID-19 lockdown, due to reduced rate of physical activity and the prolonged sitting time without appropriate ergonomic supports during remote working. Social isolation, including loneliness, pain catastrophizing, somatization, and the incremented risk of anxiety and depression. For limited finding, positive of the studies and depends on the recent capacity to analyze the relationship between COVID-19 lockdown and low back pain. The baseline characteristic of the sample in the studies was represented by both patients suffering from chronic low back pain and patients who developed low back pain symptoms during the lockdown. Study by El-Karaiji et al. In 2021, almost 79% of the COVID-19 cases has had low back pain. It was mild among 31.3% of the cases, moderate among 25.3%, and severe among 12.5%. 54.8% of the cases who were aged 45 years or older were found to have moderate to severe low back pain in comparison to 23.5% of the young patient, while 43.6% of female cases had a moderate to severe low back pain compared to 27.5% of the male cases. The limited finding is the sample size of the study was small, and this might result in the under or overestimation of the prevalence of low back pain. Chronicity of low back pain is not addressed in the current study, so it is unknown if the low back pain after the quarantine period is a first ever episode or recurrent of previous episode of low back pain. According to study by Mossen et al. In 2022, the significant outcome is the individuals are more prone to poor quality of life than others during the pandemic due to some socio-demographic background, financial status, and experience with COVID-19. Also, it stated that COVID-19 impacted the quality of life more significantly in female than males. For limited finding, the study only involved participants from a single locality, so the study finding cannot be generalized to all Egyptians. Study by Leong bin Abdullah et al. In 2021 frustration due to study disruption, living in areas with high prevalence of COVID-19 cases and a higher severity of depressive and stress symptoms were significantly associated with lower quality of life. For limited finding, participants were not randomly sampled. They may not be representative of university students in Malaysia. Study by Park et al. In 2021, there was a significant decline in physical and other meaningful activities, including activities of daily living, leisure, social activity, and education. Participants with quality of life and mental health had decreased after the pandemic struck. For limited finding, small sample size limit the generalizability of our findings to entire South Korean population. So for the problem statement, both study by Papalia et al. In 2022 and Al-Karaji et al. In 2021 use either low back pain is get during COVID-19 pandemic or before. Hence, there should be confirmed the low back pain is get during COVID-19 pandemic or not. Small sample size may make it difficult to determine if a particular outcome is true finding. If sample is not randomly selected, it will probably be biased in some way and the data may not be representative of the population. For research question, what is the relationship of post-COVID-19 with quality of life among students with low back pain in UiTM campus Puncak Alam Selangor? For hypothesis, there will be a negative impact on quality of life among students with low back pain in UiTM campus Puncak Alam Selangor. So there are three objectives. First is to identify quality of life after post-COVID-19 pandemic among students with or without low back pain. Second, to compare quality of life after COVID-19 pandemic between university students with low back pain or without low back pain. Third, to investigate the relationship between after post-COVID-19 pandemic quality of life among students with and without low back pain. For methodology, research design, we use a cross-sectional design study and setting. The setting is in students from different faculty in UiTM Puncak Alam Selangor. Sampling design, non-probability sampling method, cheapest and easy access to sample, initial understanding of small research population, purposive sampling method. For target and study population, the target is student UiTM Puncak Alam who were infected or not infected with COVID-19 and may have low back pain. For inclusion criteria, full-time undergraduates, postgraduate, and foundation students presented with low back pain before or after being infected by COVID-19. Students study in UiTM Puncak Alam during or after the pandemic COVID-19. Volunteered to participate in the study. For exclusion criteria, previous spine surgery in the past 6 months, presented with specific back pain, and have neurological disorder. For sample size calculation, we use the Rausoft software, which is the sample size calculator. So for the margin that can be accepted is 5%, and then confidence level that you need is the 95%. The population size is 19,991. The response distribution is 15%. So the recommended sample size is 377. So this is the procedure for flowchart, which is first literature review, and then proposal writing, and then apply for ethic application, and then it will divide into two, which is approved or not approved. If it was approved, and we begin the prepare questionnaire, and then move to the data analysis, presentation of the data, and then writing report and submission of the report. For ethical consideration, require ethical consideration because the data is being collected from human being. Request approval from UiTM Research Ethics Committee. Important for subject confidently, no harm through the research process and ensuring public trust. For data analysis, For objective to identify level of pain and physical activity among post-COVID-19 pandemic students with or without low back pain. So the parameter to be analyzed is descriptive statistic used to describe the basic feature of the data in a study. So we use the statistical analysis is descriptive analysis. For objective to compare the relationship of pain and physical activity among post-COVID-19 pandemic students with or without low back pain, we use the parameter t-test, which is a pair sample t-test indicate that there is a significant difference in some of the study variable. And then for objective to investigate the relationship between after post-COVID-19 pandemic quality of life among students with and without low back pain, we use the parameter Pearson correlation coefficient, which is to test the statistics that measure the statistical relationship or association between two continuous variables. The feasibility of the study is, first, it is inexpensive because the study just need to hand out survey and no need further equipment and tools. Chances of students developing low back pain during post-COVID-19 pandemic are high, easy to hand out survey to the students, and can be used as future research reference. Okay, so this is my Gantt chart. So the discussion on topic title is on January in 2022. For problem identification is on January to March in 2022. For literature review is on February to May in 2022. And then for proposal writing is from February to June in 2022. For instrument finalization is from April to May in 2022. And for the defense research proposal is on June in 2022. And then for the applications of ethics is from June to August in 2022. And then for ethics approval is from July to the September in 2022. And for the data collection is from September to the December in 2022. And for the data analysis is from September in 2022 to the March in 2023. And then for report writing is from the October in 2022 to June in 2023. And then lastly for the final presentation and submission is from June 2023 to the July in 2023. This is the reference for my presentation today. And then that's all from me. Thank you.